Welcome everybody to the Depths of Motherhood podcast. This is a special season dedicated to the tribe of the mother, but also I know any mothers listening will find this extremely valuable. I've created each episode to offer simple, digestible, and supportive information, which I hope will educate and inspire anyone who listens. So this is by popular demand. Please help us to educate and support the tribe holding the mother. Look forward to passionate and highly knowledgeable guests dedicated to reclaiming the essence of birth and embracing conscious parenting. Throughout our time together, our guests will serve as the guiding voices, illuminating the path towards a deeper understanding of preconception, pregnancy, birth, and postpartum. This is with the mother and the baby being the center of the exploration. In the show notes, you'll discover the link to Nourished Mother package, which will offer many different resources to complement each episode. This is free for all members in the Women's Circle, or £33 for everybody who just wants to purchase the package. A heartfelt thank you to our incredible guests and immense gratitude to my partner for supporting me on this creation. And finally, last but not least, special thank you to Araya, my daughter, for being the endless well of inspiration. Welcome everybody, we are here again, and this week we are joined by Becca Meredith, who is also known as Enlightened Pelvic Health on Instagram. Becca is a passionate advocate for women's health. Her journey began with a bachelor's in health studies and a master's in occupational therapy. Her career spans from home health to hospital settings, and in 2018 she qualified as a yoga instructor specializing in chair yoga, prenatal and postnatal care. Driven by her own pelvic health challenges, Becca pursued advanced training, including pelvic floor therapy and certifications in pregnancy, postpartum corrective exercises. She is also a Reiki 1 practitioner and completed training in holistic treatment of the postpartum body. In this conversation, Becca shares insights into pelvic anatomy and physiology, the significance of optimal positioning during childbirth, factors influencing pelvic healthcare, practical ways that you can connect with the pelvic floor today, and incredible information to support postpartum care, including awareness around prolapse. This episode was recorded earlier this year when me and my family were on a beautiful little island called Sark, which is in the UK but closer to France, and it was during the winter months, and Araya was coming in and out to join us all the way through. And I really love diving into this conversation because you may have heard during these past episodes that during my birth I tore, and I spent a lot of my postpartum tending to this wound. Yet this actually helped me to reconnect to my pelvic floor, to my body through my breath. So as we go into this conversation, it really wakes up and reminds me of a lot that I went through as well. You can find all Becca's information in the show notes if you'd like to reach out to her. So I really hope that this conversation supports you. And remember, you can pass it on to friends and family who you think that this may support. So a little update on my family. We are currently in Europe, on another island actually, and we are day 2 of jet lag. And actually, Araya's taken it really well. She slept through the night last night from 11 p.m. all the way to 10 a.m., which is incredible because me and Elon didn't do so well. We went to bed at 3 a.m. and I was waking up all the way through the night. So I am nursing myself back to a balanced state. And I am not complaining because this place is incredible. We are by the ocean, again, a car-free island, absolutely incredible. And what's lighting me up at the moment is that I am being moved from the concept of motherhood as a spiritual practice to actually embodying it and a deeper knowing. And there is so many downloads that I'm having right now, and so much that is coming within the circle of women that I sit with and I chat to. So we'll see what happens with that. But I'm having a vision of a mother's circle online to really hold space for this beautiful spiritual practice called motherhood. And the final thing that I want to mention is we have a circle on the 14th of July, which is a Sunday. And this circle is exploring what it means to live as abundance. And this is kind of flipping on the head most of the mainstream conversations about abundance. the mental realm of creating abundance. We're going to go before that and go to the very heart of what abundance is. And from that point, allowing ourselves to vibrantly ripple out into the world. This will be an interactive circle where I will be offering you questions for reflections. So I really hope that you can join us. The link is in the show notes. This is free or donation based. We have a limited amount of seats. So if you go in there now, RSVP, and then I can send you the Zoom link and we can meet and chat online. Thank you so much for being here. Before we begin, let's just take a deep breath and wiggle into our pelvis. So if you can come to lengthen through your spine, feel the crown of the head moving towards the sky, and feel into the left and the right sit bone if you're sat on the chair. If you're walking around, just come to rock between the left and the right foot. And see if you can get some movement as you're sitting here. Maybe some circles with the hips, a tucking under of the tailbone, a releasing and sending back. And notice how that ripples through the whole body, through the chest, through the neck. Seeing how it feels to exist inside of your body. And let's go for this movement a little bit more deeply and include the breath. Let the breath come down into the pelvis. Let it dance around this space into your abdominal, into your chest. All right, let's get in there and listen to what Becca has to say today. And I want to say a massive congratulations because Meredith and her family welcomed a little girl into their tribe. She came in April. Whilst we recorded this, she was pregnant, obviously. And so it's so beautiful to see your daughter come earthside. And I hope that you are receiving the nourishment and rest that you deserve in this postpartum time.
Today, Becca joins us on the show. Welcome. Where are you in the world?
So I am in the United States. I am specifically in the Midwest, so right in the middle of the United States. I live in Illinois, but I'm very close to St. Louis. So that's kind of my point of reference that I rock with.
Tell us a little bit more about how you got into doing the work that you do.
Absolutely. So I've been an occupational therapist. That's kind of my bread and butter. I've been an occupational therapist for over 10 years now and primarily worked in the geriatric population, lots of nursing homes, skilled nursing facilities, old folks' homes, whatever you call it, hospitals, home health. I've done just like a whole bunch, but typically with the geriatric population. And then about 5 years ago, I got into yoga and started teaching yoga, went through teacher training and all that good stuff. I just so happened to be pregnant with my second. I kind of was encouraged to learn how to practice yoga vinyasa base, but also have to learn how to modify and change because I found out my very first day that I did teacher training, I found out I was pregnant. And so during the whole 6 months of training, I had to change things for my body. Whereas the people that were going through it themselves were not pregnant. So they just kind of got to go along to the poses and all of that stuff. And I had to really be mindful of this growing belly and my body that was changing. And I had a pregnancy before. I had my firstborn. He was a couple years old at the time when I got pregnant with my second. And so I had an idea, but it was just very different. And I've always been an athlete and I played soccer in college and I've always loved being active. But this really challenged me to kind of go outside of the box and see okay, well, how can I keep doing these exact same things just in a different way? And so that kind of really sparked my interest in women's health in general. Pregnancy, of course. I had some leaking and some incontinence and some pelvic pain after I had my first. I really didn't do anything about it, which now looking back, it's like, how stupid was I? Why didn't I do something about it? I'm a medical provider. I should have known, but woulda, shoulda, coulda. Being pregnant, going through teacher training, all of that really kind of encouraged me to challenge myself and learn a lot. I also had kind of switched from a traditional OBGYN practice to the hospital with my son. I switched to midwifery care at, I think I was 32, 33 weeks with my daughter, with my second. And that was really a big deal for me. Just having a different mindset in care and what my birth wish list, my birth preferences were for her, going a not so traditional route in the States. It's definitely getting better and improving, but it's just a different option, different approaches. And so I actually had a very traumatic labor and delivery with my daughter. That kind of led me into subspecializing into birth trauma at this point too. But she's doing wonderful and fantastic now. And then kind of continued to fuel that fire after I had her and getting back into fitness, getting back into yoga after I had her, being aware of all the things that could happen to the body after you have a baby during pregnancy and how to modify and how to change things, but still be able to do the things that were important to me. And then fast forward to when I got pregnant with my second, who is about 18 months, I kind of just decided the traditional approach to the medical world and being an occupational therapist in the geriatric population wasn't for me anymore. I think that was fueled by the pandemic and the challenges that came with COVID. And it really just encouraged me to step out and started to do some training, specifically with pelvic floor therapy, offering internal work, and all of the worlds kind of connecting together as being an occupational therapist for a while. Started my teacher training and mind, body, spirit type of approaches to going through motherhood and its challenges myself. So yeah, that kind of is what led me into this point, and then going through my third pregnancy and doing all of the training to really delve into it. And so I started my practice this past April. So it's still pretty much in its infancy. And now I'm pregnant with our fourth and just trying to figure this whole thing out. But yeah, it's all great. There's a passion there. And I think that's important for all of us to follow our passion of whatever it is.
Thank you. Your journey has took you to this point, like literally, you're in this yoga class, you're pregnant, and you're like, wait a second, I have to make adjustments for myself for this to be comfortable. I'm curious with that, how you found the difference between what you were being taught in your class to what your body was actually calling for. Was there adjustments that you had to figure out for yourself, or was the instructors guiding you, or was it something that wasn't in their scope?
A little bit of both. Both of my teacher trainees had pregnancies themselves and had had pregnant students before. They had an idea of the modifications, and it sounds crazy, but a lot of prenatal modifications that I've taken have kind of been similar to the modifications that we had to take with the geriatric population, or maybe a slower yoga flow or chair yoga or something like that. And so I think I've had a little bit of like a level up in just understanding like the aging body and how can we encourage my patients that are in their 70s, 80s, 90s, or 100s? How can we change this exercise specifically for them? How can we make it so that they can do this exercise, they can do this functional task just in a different way? And so I felt like it was kind of similar in that stance, like, having this growing belly, having aches and pains, and, just the mental emotional side of things as well is what OTs really can hone in on. And so being aware of all of those changes and not losing my mind and finding triggers or finding the ways of support and all of that good stuff. So yeah, it was a lot of self-exploration, a lot of kind of finding things out on my own and just being curious instead of criticizing ourselves, which I think a lot of us moms do, and just being curious with movement, breath work, mindfulness. How can these in yoga, that's kind of how yoga is different than typical fitness world of CrossFit or boot camps or Pilates or anything like that, is yoga has this kind of mind, body, spirit aspect to it, and the Yoga Sutras and lots of different philosophies that are, more on the inside. And so I think that whenever I started practicing yoga and learning about these different fundamentals that they base yoga on, that's not just stretching, it's not just breathing, being able to connect that as an occupational therapist and how I was treating with my patients was looking at their mental, emotional side of things as well was huge too. So yeah, I think that answers your question.
As you're sharing, there's so much that I want to get into from my own experience, but I'll stick with the guidance because it fascinates me so much, especially when you're bringing in yoga and everything and the things that come to life. Okay, whoever's watching the video is going to see my daughter. If you're not, you're going to hear some random noises, and they're coming from underneath my jumper. She finds my breast, which is a common thing in this podcast. So there we go.
Right? Well,
Oh, she's got a singing voice today. So when I was putting it out to the listeners, like, what do you want me to ask? What questions? The thing that they were drawn to a lot was, what are the causes, the main things that you see in your practice that are causing pelvic pain? And this is coming from questions for women that are in pregnancy and then also postpartum. But through these questions, I will go through like the whole spectrum. But what are the things that show up for you most in your practice?
Absolutely. So it can be a lot of different things for during pregnancy, there's so many changes that are happening throughout our bodies. So it's like literally like the pelvis is tilting to be able to modify because you're having this growing belly. So then we forget about our entire backside or back body. Anatomical changes for sure. The ligaments are changing, the structure's changing during pregnancy. And although those things do primarily go back after you've had a baby, the hormones are wild after you have a baby and in that postpartum and postnatal phase. And so things don't just snap back into place. Scar tissue is what I'm finding a lot of issues that are causing pain because if you have scar tissue, whether it's from a belly birth, from a cesarean, or whether it's from a perineal tear from vaginally delivered, maybe it's healing, maybe it was an episiotomy. I think those are definitely becoming the rates drastically coming down. I've had an episiotomy with my first, which I think is honestly what caused all of my pelvic issues. But if you have that scar tissue, it's doing its job. It's closing the wound, healing everything. But there's a lot of trauma that's held in that space. That scar tissue can really tug on its anatomical structures. It can tug on the fascia, and that can definitely cause a lot of pain. So I'd say like anatomy changes that we have during pregnancy, or even lifestyle. Like you can not even go through a pregnancy and still have pelvic issues. Maybe they sit at a desk all day long, or maybe they drive in their car a lot. So that can be a big factor. Genetics are huge, which is kind of a hard thing because it's like as much as you wish that you could change genetics, like that's just the body that you were given, unfortunately. It's so interesting. I have a patient right now that she just tried to go for her VBAC, her third one, and she had third belly birth, the third cesarean. And so we're trying to troubleshoot, like, what in the world was it? She said, my mom had 4 C-sections. And it's just like, okay, so like, is there a genetic component to it? And just trying to figure out like what that is. And they have a lot of back pain and restrictions with mobility. So maybe that's a genetic factor. So it can really be a lot of different things. Going through a pregnancy and having that kind of bowling ball on your bouncy ball of your pelvic floor is definitely going to cause some havoc to labor and delivery, how you position, what position, or how you labored and delivered, what position your pelvis was in. Is the pelvic bone kind of stuck or favoring a certain pattern that we could put it back into place because those muscles are being stretched out? A lot of factors that can definitely cause pelvic pain and pelvic discomfort or dysfunction.
Yeah, I'm just realizing like what a massive question that is.
It truly is.
Okay. You want to do a whole podcast on this? And also people's how their relationship is with pain. And I also feel from my own experience, what I would have classed, what I thought was I was experiencing sensations in my pelvis that I really considered that there was something wrong with my body, that something was not working right or something was damaged, when actually as I reflected and listened to stories, I'm like, oh, it's just my body's way of adjusting and moving. And I really had a strong connection to that being a negative thing instead of feeling into it and it being the process and the journey. And I think, well, for me, this is my first child, but it's been a massive journey back to understanding the language of my body. And I think that's kind of like a pendulum as well, like going through the discomfort to figure out what did that actually mean. So I didn't prepare before I conceived. I didn't have this in my mind. I just continued my Ashtanga practice all the way through my pregnancy, like probably till a few days before I gave birth. And I realized now on the other side that I hadn't done any practices to soften my pelvic floor. And if I use certain words, just pull me up because I'm just using language that I know. But I would be always very deeply interested in my mullabunda, which I now understand more deeply. to what that actually means. But at the time, what it meant for me was contracting and drawing up and constantly having this tension in my pelvis. And I also think this came from a big fear of leaking or having a prolapse from stories that I'd heard from my family and my friends. And it's funny because I was a nurse before, but none of this clicked into place. Like during my pregnancy, kind of all went out the window, and I was just like, just stuck on these certain ideas and beliefs around it. So I would love for you to go into what some good practices could be for mothers during pregnancy to support that pelvis at this time, and also unpack anything I've just said as well, if anything came through.
Absolutely. Absolutely. Well, and that is like a common misconception is that, I think it's definitely getting better. Thank you to social media. But, a tight pelvic floor, a strong pelvic floor, the bandha, the energy, the chakras that we have down there, we want them to be strong. We want them to be able to stabilize and support. And that's important at the time when we need it to have. But a lot of pelvic floor therapists will give the example of like your bicep, your arms. So you have to be able to flex it and bring your hand to your shoulder to be able to hold a weight or hold the groceries or feed yourself, whatever. But you also have to be able to straighten your arm. And so the pelvic floor is definitely drastically different. It's not a bicep, it's a bowl. But you need to have great. You need to have the contraction. You need to have the support, the stability, all that lovely awareness that you did. But you also need to soften and to relax. And especially, for everybody, but especially for the pregnant mother that is about to deliver a baby. Because the pelvic floor is not what's pushing the baby out, that's the uterus. And the pelvic floor is honestly, it's like a curtain or like a door or a gate that just needs to open up and needs to soften. And so if you have a tight pelvic floor, hypertonic pelvic floor, any kind of tightness throughout the hips or any of those muscles, you know, is that going to cause problems in labor and delivery? Maybe, maybe not. And that understanding of your body. And that's the thing is that a lot of my patients that come and see me, they have no idea. I'm like, okay, go ahead and do a Kegel. Whatever you think a Kegel is, a pelvic floor contraction is what this is called, or engaging the mula bandha. And they just squeeze their back cheeks, or they squeeze their inner thighs, or they tilt their pelvis up. And it's like, okay, but I want you just to focus on these muscles, in which we didn't even talk really much about the pelvic floor in general, but it's this diamond shaped bowl. It's not a hammock. It's not a bicep. It's not like a singular muscle. It's a group of 14 to 15, 16 muscles that are kind of interwoven all together. And it sits within the pelvis. And it's this diamond shaped bowl. So you've got the pubic bone, the tailbone, and the sits bones. And so it kind of looks again like this diamond. It kind of has a hammock-ish appearance, but that's what supports our internal organs. It's important for intimacy and sex, bladder, bowel health, all kinds of good stuff. And so having that awareness, so like back to like the exercises or the awareness during pregnancy, is really important to have, because maybe then you'll have the mobility, you'll have the connection to your breath and all of that good awareness going into labor and delivery, so that whenever you are in the thick of it and you're like, holy no, you know that you're lengthening your pelvic floor, which is really hard to do when you're in labor because your whole body is like, contracting in. But if you can soften, that's going to probably improve your experience, improve your outcomes after you've had the baby and your recovery as well. So specific things to do. I think the number one thing that I do with all of my patients, especially with pregnancy, is breath work. So many of my pregnant patients have no awareness of their breath, and they can't breathe because there's literally this baby that's growing inside and they can't breathe. But if they have a good awareness to their diaphragm and big diaphragmic 360-degree breath, they're going to be able to feel the expansion at their back bodies, which is connected to all the fascia back there. And they're going to have a connection to their pelvic floor. So you got the diaphragm as like this top parenthesis, and your pelvic floor is the bottom parentheses, and they work together. But if you take a big breath in, your diaphragm and your pelvic floor descends down. It lengthens, kind of stretches out, I guess you could say. And then when you exhale, you can feel kind of it just like naturally falls back into place. So it's a little bit of engagement there. So just by monitoring your breath, just by being in tune with this lovely, lovely awareness of your breath, you're able to access the pelvic floor. And it's good for your nervous system. It's good for your heart. It's good for kind of just centering everything, especially going into labor and delivery. One thing that a doula had told me in the past was, and it's so true, if you can hold on to your breath during labor and delivery, nobody can take anything from you. And I think that carries over for everybody, and especially in my yoga practice, when I teach yoga students, it's like, you be in charge of your breath. Let that be your power. Let that be your driving force that grounds you down, because nobody else can take your breath away. Contrary to songs and all of that good stuff, if you are in charge of your breath and let it be your boss, then you're in charge of everything during motherhood, pregnancy, postpartum, and on.
Wow. So I don't know why it got me emotional. It got me like tearing up. I'm also breathing and feeling my pelvis right now. When I gave birth, I was in this point where I really wanted to understand or to feel into my pelvic floor, because for one, it was screaming at me, because I had an episiotomy. I didn't want to look away because I know my personality could be to turn away, pretend nothing's happening. But instead, I got a mirror. I was looking, I was breathing, I was doing my yoni steam, and I wasn't even intentionally doing breathwork practices, but just by slowing down helped me to feel how much my breath is connected to my pelvic floor. And then I continued as I continued to heal, I continued to do the breathing practices, and it just woke up this whole like curiosity inside of me of what that actually means.
So much more empowered, and the one word that you said that I just want to point out is connected. And that's just, I think during pregnancy, it's just from a physical standpoint, yes, we lose that connection. We lose that awareness to our body physically because things are changing and it feels like it's like a shell. And so by using the breath and seeing specific mindfulness and exercises, whatever it is, you're able to connect. And whether it's connecting to the deep muscles of your core and your pelvic floor, or whether it's connecting to yourself, because during motherhood, it's just you go through this pivotal change. And again, it's back to that mental, emotional side of thing, that spiritual side of thing, where you feel like you're just losing it literally, and you've just lost yourself. And so just by tapping into the breath, it's so much more than just this physical exercise. It's connecting to yourself, your truest form of yourself. And so many of my moms and some of the patients, they lose sight of that after they have kids because it's constant surviving that we're going through. And I get it. I'm there. I'm right there with you. But we have to be able to take care of ourselves, connect to ourselves, and be who we truly are in order to be able to take care of our kids and take care of others that are around us. And I think that that's just such an important message that's out there, and it's a lot easier said than done, but connection is everything. I mean, it's everything.
I really love that. It's such an important reminder, because there is this feeling that I went through personally of, I felt like so hard done by because I didn't have the tribe everyone's talking about. I didn't have all this support. But then I really had to get to this point where I was like, okay, no one's going to do this for me. I really have to do it myself. And of course, asking for support when needed, but just finding that inside of you where you can take them few minutes to do them practices. And there was something that you said earlier that you touched upon, and you said like the pelvic floor being these curtains to soften and to open, which I really love that. Like that idea is so beautiful.
Big shout out to our sponsor, Evolving Humans, who are the pioneers for energy healing. This practice that I was taught 4 years ago has been studied by researchers all around the world to provide evidence of the physiological effects of energy healing. And I'm not just saying this because it's a promotion, but I have used this practice every single day for 4 years, and personally I've noticed the most impact in my emotional state. This energy practice taught me how to feel energy in my body and observe the sensations. The technique involves you using your hand and connecting to the energy field within your body. And with this gentle, loving awareness that you bring to the table, everything is seen and lived. The whole being comes into alignment. During the birth of my daughter, I tore, and the discomfort that I was experiencing with this tear started to ease up dramatically when I would use this technique. In the show notes, you'll find the link to Evolving Humans so that you can explore this healing technique, which is available through a course that you can join today.
And maybe you could explain a little bit more about fetal ejection, if no one's heard of that, because I feel like that kind of comes into it, because there's this idea that we have to do something when actually the uterus is doing the work.
Absolutely. So that reflex is awesome. And I was like, whenever you sent that message, I was like, research this more because I know what it is and I know what happens to the pelvic floor, the pelvis, and the shape and all that good stuff during labor and delivery. But I'm just curious, like, if it happens in everybody, and it doesn't. Typically in a hospital setting, what do you have going on? You have the bright white light, you have the white lab coat, you have 20 people in the room, what have you. And then how do you feel? Does your body feel safe? Does your nervous system feel nice and calm? Are you breathing those big, deep, lovely breaths? Are you maybe shallow with breathing? Is it really quick because your heart rate's up and your blood pressure's up or baby's vital signs are changing? All about the nervous system, but about safety that we have in our pelvis, in our pelvic bowl, our womb. Everything is very known for creativity, sexuality, all that good stuff, but security and stability. So the sacral chakra is known for this, and that's in yoga practice. Having that kind of security is going to be something that's going to allow your body to feel safe to be able to welcome a baby into this world. If you think of a mammal in the wild, like a lion or some kind of animal in the wild, they have to be safe in a cave away from their predators to be able to have that baby, to be able to be born. And it's so true because babies are smart. Like I just had another patient that had some complications. And so I was reaching out and like, don't know what's going on. And it's like, my mentor said, babies are smart. They're not going to come into this world if they don't feel like they're safe. Mom is not going to feel safe and feel like they can lengthen their pelvic floor and let everything go where the uterus expels the baby and literally pushes the baby out if they don't feel safe. And so, typically, again, and I'm not knocking hospital. I've had all my babies in the hospitals, but I'm not knocking this setting. But if you have these bright white lights and you feel like you're in danger, are you going to be able to have that reflex where the uterus just shoots the baby out? Probably not. Safety is the word that comes to my mind when it comes to being able to have a baby with that reflex.
Right. Thank you for doing the research into that and sharing. It's fascinating. So what actually happens as we're giving birth to the pelvis? What is the movement? How is it adjusting?
Yeah. So there's the different levels of the pelvis that we have. We have the top of the pelvis, the middle of the pelvis, and then the outlet, the inlet, the mid pelvis, and the outlet. And so the baby's position is going to kind of play a factor into what kind of movements of the pelvis is going to be going through or what kind of movement we need to put our pelvis through, whether it's physically using the muscles or whether we're using a peanut ball or a birth ball, whatever. So early on in labor, so early labor, baby's probably going to be up pretty high, and we want to be able to get the baby to engage to the top of the pelvis. And so typically we want to think of external rotation, so open hip to be able to invite the baby to engage down. Once the baby gets down to a certain level or a certain station, we want to start to get them even more engaged. So we want to do some like asymmetrical movement. So thinking of like kind of rocking the hips forward and back, side to side, getting them kind of, I think of it just like snuggling down even more. And they're usually going down still pretty straight at this point. And then whenever baby starts to descend down and they're really like, okay, we're to that lower station where we're ready to come out through the pelvic outlet, the sacrum has to kind of like pull back and the tailbone has to get out of the way. It's like a trap door. That's why J breathing is such a lovely breath to use during labor and delivery, because that's the path of the baby. The baby descends down and they turn their head to be able to descend down and out. And so then that last layer or that last position of the pelvis, the outlet of the pelvis, internal rotation is something that a lot is probably on social media and a lot of pelvic floor therapists are getting into or birth workers because the internal rotation, so turning the knee in, the toes out, is going to bring the sits bone, those bony parts of your butt, that's going to bring that out. So whether you're in side lying, whether you're in hands and knees, or you can be on your back as well, but the sacrum lifts up, the sits bones we like to splay out. And I want to give the caveat of like, I can be like, this is exactly how it happens, but it's so different for everybody. And so it just depends on the mom. It depends on the pelvis. It depends on the provider and the baby too. But that's like typically the descension down in the patterns of the pelvis.
You did such a great job at using your words to do that. It's not the easiest of things, but I had the vision.
No, it's really hard to like, I don't know, because it's like I don't like to use like the big words and all the, anatomy terms and all that stuff. You have to put it into layman's term, because it's like we want people to understand like what's happening, be able to visualize it. And it's like, I'm a logical person. Like, yes, this is what I want you to do, this muscle, this engagement, this part of the pelvic bone. But it's like, bring it down to simplicity. And like I said, everybody's different. So it's definitely not a one size fits all. The patterns kind of leading into postpartum is a course that I just took this past fall. Lynn Schulte, she's over in the States. She's a physical therapist. And so her big thing is treating the postpartum patterns that we have. And so after we have a baby, the pelvis opens up, the sacrum kind of cocks back a little bit and is able to get that baby descended down. And then as it starts to move through, the sacrum starts to straighten back out. And then it starts to have that lift up of the tailbone. The baby can be able to get out. And so sometimes that sacrum likes to flex and stay in that pattern. Same thing with those sits bones. Is like, yes, we like to have the internal rotation of the hips, but then that sits bone likes to lay out to the side, and then it stays there. So then if it stays in that pattern, then those muscles will be lengthened on that pattern. And then they're maybe not engaging, not firing up, supporting as much as we would like them to be. So again, that's like kind of like leading into like your labor and delivery story is why it's so important, like to have an idea of where you win. Positions did you favor? What were tougher for you? What position did you deliver in? To be able to really assess the pelvic bones, to be able to get them back into a nice, happy, aligned spot, and then be able to have the muscles follow with that as well.
Thank you for sharing that. It makes me think of it. Well, for so long we've been told how to birth, from through the system, and I mean, there's a lot to go into there, and we have gone into this in some of the other episodes. But just by understanding what is happening physiologically and knowing our options and how we can support our body, whether we end up birthing on our back or not, is secondary. It's just knowing that you have options. Because I recorded so many birth stories on this podcast, and they've been like, I had in my mind, like my knees together, feet apart, everything was ready. But what my body wanted at that time was to be laid on my back. Like that's all it wanted. So it's really just to get this information in, to know what's happening, to know what options you have. And really just in them moments, it's listening to the body. And I think the information plus the body practices of feeling and getting acquainted with your body again will serve you in them moments.
Absolutely. And I love that, because it's like, yes, that's the same. Like I can be like, okay, at this point of labor, I need you to be in here. And when this baby's at this station, like be here. And it's like, no, we're intuitive spirits. We're supposed to listen. Like I had my last baby on my hands and knees, and I had an epidural like right before I pushed him out. But with my other two, I was like, my second, I was like, I'm going to be on my back. I won't be on it. But I was so tired. I was so exhausted. It was like, well, this is the way that the baby's coming out, because I can't move. And so yes, you can do all of these things, but like know that we, Becca and Danielle, support you and how you feel like you need to move your body. You do with it. And if a provider doesn't agree with that, maybe have that awareness. But even going back to like the preparation, like exercise to do whatever, we said breath is my number one, is birth rehearsal. And so like actually putting yourself, actually trying different positions, visualizing as if you were in labor and delivery, and it's, whether it's discomfort, pain, whatever you want to label it, wave, contraction. Does this feel like this is a safe space for you? Is this something that you can visualize and practice to yourself? Because nothing, as much as you can prepare for it in that moment, it's going to be like, holy moly, this is a crazy experience. There's so many things you can do, but like, that's why I like birth rehearsal is what it's called, or birth practice, whatever. So it's like you're visualizing yourself in that moment. Is this position for your pelvis comfortable for you? Kind of thing.
That's so right. Is there anything else that you can think of as we're like focused right now on the birth, the part of the birth, so like going into how the pelvis is moving, the positions that we can get into from the perspective of the friend or the family? Is there anything that they could do to remind them whether or support them whether? Is there any advice that you would give?
Absolutely. I think, having that plan ahead, which I hate calling it a birth plan, because then if we get stuck to a plan, it can drastically change so quickly. And then we get let down and we're like, I didn't follow my plan? And so birth preferences or birth wish list, I think is a nicer term that you can utilize. But covering over that with your family or whoever you plan to have in your room of, look, this is the position that I would like to try to push in. Can you give me that gentle reminder of, hey, when we talked about this, you said that you wanted to try and push in your hand to me. Let's try and get in that spot. Or, what kind of things does it feel like if things are going to be stalling for me, what can I do as your support person to be able to encourage things? Is it getting on the toilet? Is it getting up out of bed? Having a little bit of a game plan, a game preference of how they can support you. And also just knowing that I'm not there during labor and delivery, so I only know my story and the stories that I've heard of my patients, but there's gonna be a defining moment that the birthing person is tired and exhausted and doesn't wanna do this anymore, is gonna feel like they're throwing in the towel. And so I think that that support person, knowing that that moment is going to happen and that's your time that you have to show up. That's your time that you have to be able to connect with them, whether it's literally making eye contact with them, whether it's breathing with them, whether it's reciting their mantras, their Bible verses, whatever it is that they have that grounds them down, to be that support person, to support them through this crazy, crazy experience. I think that's, just talking about it, having an open conversation so that you don't get into the moment and be like, what should we do? Like we're scrambling, like having confidence and going into it, whether you know what you're doing or not as a support person, being that even keel and being that energy to kind of calm everything down. To, you have those bright lights going on. Can you turn the lights down? Can you tell your partner to close their eyes? Can you get an eye mask for them?
I think
But
it's
yeah,
so helpful because this preparation before, just so that in the moment when things seem to be going a little bit wild, you have some tools to pull out, or you've considered these things with the mother before, and you can step in, and whether they're what she wants at the time, whether they're going to work in the moment is kind of secondary, but just having them there again as options. It's always as options like this
yeah,
preparation. So
absolutely.
Mama's had the baby. And she's at home or in hospital. What are some top tips that you would offer to start supporting the pelvis?
Absolutely. So I would say definitely part of the postpartum is planning before the baby is even there. So the fourth trimester, they label it as those first 12 weeks after you've had a baby. So I always like suggesting planning ahead, whether it's meal prep, whether it's somebody else coming in and caring for an older sibling or for a baby. What kind of support do you project to need after you've had a baby? So the postpartum planning even comes before the baby's even here. So then, whenever you are home and you're sleep deprived and your body is physically exhausted, you don't have to worry about who's doing your laundry or if you have clean clothes or what you're going to be eating, all of that type of stuff. So that's probably my first tip is like to plan before the baby, before you're even home and everything's all good to go. I think also having your resource list of like IBCLCs or CLCs or breastfeeding, if that is something that is a goal of yours, to have that kind of connection already with somebody that can pop into the house or that you have quick, easy access to. Of course, a pelvic floor therapist is wonderful to have that kind of support too. There's postpartum doulas that can come into the home, or maybe it's a family friend or somebody from church that's coming in and having that set schedule of Tuesdays and Thursdays. They're going to come in for a couple hours so they can hold the baby and I can go take a shower and brush my teeth or go for a walk or go get a coffee or whatever it is. And so having that kind of plan before baby's even here. Now, physically, whenever the baby is here, having some time and some space away from the baby, which I know that sounds crazy because it's like you're supposed to have the baby with you, but having some time to be able to breathe, again, back to that like breath work, exercise, all of that good stuff, having some time to take that big full breath in, full breath out. And like, honestly, there's some exercises and all that stuff that we can definitely do because we went through these drastic changes through the posture of being pregnant to now having a baby, and whether you're feeding the baby from breastfeeding or feeding it with a bottle, now you're kind of crunched over. There's different exercises that you can do, but I'm a big fan of rest, of not doing anything actually. And so whether you're laying in bed with the baby and you're doing that gentle breath work or visualization or whatever it is, taking a little snooze, you having somebody holding the baby, having your partner hold the baby so you can take some time and some space to be able to do something for yourself. Of course, collagen, rich protein, vegetables, warmer nutrient type of foods are going to be great for tissue healing, especially if you did have a episiotomy or you did tear or something like that. That's going to be beneficial. Bowel health is huge. I love to talk about all of this stuff. So poop is very important after you've had a baby. I know it can be very intimidating and scaring. So making sure you're in a good position whenever you're going to the bathroom, you're breathing, you're softening, you're lengthening, whether that's taking, stool softeners or using that warm fluids and warm, hearty, healthy foods that are going to fuel you to be able to have a soft stool. Fluids, of course, drinking. It's super important to stay hydrated. That's good for tissue health as well. But rest. And I know that sounds a lot really hard to do, but not being 2 days post having a baby and feeling like you have to do your laundry and standing up and going for a 30-minute walk. I think a quick 10-minute walk, within 2, 3, 4 weeks after, just to get out of the house and pop the baby in the stroller is wonderful, but nothing really more than that. Nothing that needs to be excessive, honestly.
Can I ask you about the pooping? So
Yeah.
is there a good position that could support our pelvis for having a nice poo?
Absolutely. So it depends on the person for sure, and it depends on the pelvis and what they've got going on. But the squatty potties are very big in the States. So essentially, it's just a stool that you place underneath your feet. So whenever you get your feet elevated, your knees up a little bit higher than your hip, this is going to stretch one of the muscles called the puborectalis. And so it's the muscle from the front of the pelvic floor to the back of the pelvic floor. So it's going to lengthen and stretch that pelvic floor out. Whenever you sit on a toilet, I always think of like a circle with like Play-Doh on top of it. Whenever the Play-Doh sits on it in the middle of the circle, the Play-Doh gradually kind of falls down. It's the same thing when you sit on the toilet. If you sit on the toilet for like 10 to 15 minutes and your feet go numb or you start to feel this pressure at your pelvic floor, it's because you're literally sitting on the side. So the pressure is going down somewhere. And so like being aware of that. But yeah, having the knees elevated a little bit up off the floor so you're not standing on your tippy toes and your heels are lifted up. You want to have your feet kind of flat down and then breathing, connecting against your pelvic floor. You're not stopping the pee, you're not stopping the poop, holding gas in. Some providers will say like, oh, you can practice whenever you're sitting on the toilet, which is totally fine, just to bring that awareness to the pelvic floor. But we just want to be conscious of that so we're not constantly doing that because then we'll connect the brain to the bladder and the bowels and be like, oh, this is what I'm supposed to do. And it's like, no, you're supposed to just relax, let it all go when you sit on the toilet for peeing and pooping. And then when you stand up, then things resume. But yeah, so having the feet elevated is a nice option, but also just finding movement. I think sometimes like just having that kind of pelvic rocks, those cat cows of the pelvis, I think can be beneficial where it's literally you're just moving the poop out, you're getting the poop out. So, lengthening the pelvic floor, letting everything kind of soften and just like having a baby, just letting everything kind of get out of the way. And so you can eliminate poop and pee.
Yeah, I think I learned so much through pooping after I gave birth because I had the episiotomy, so I was also very conscious, but I had to figure out ways to move my body and get this poop out. So I love a good poop conversation. Do we have time for just one more question? It's
Really?
probably going to be one where you're like, this is the longest, this is going to need a really long. One of the questions that came through a lot was, how do I know if I have a prolapse or not? When to go and get some more support?
Absolutely. Yeah, prolapse is tough. So ways that you can know is that you have it is typically you're going to have like a heaviness, a bulging, a feeling of like your vagina is like falling out or like your insides are falling out of the vagina, the rectum, anywhere in the perineal area. Some people will say it feels like they have a tampon stuck or a tampon falling out of them. It can be pelvic pain. And actually, a lot of people have prolapse without any symptoms at all. So that's something to keep in mind too. And prolapse can be caused by so many different things. It can be caused by similar to pelvic pain. It can be caused by genetics. It can be caused by lifestyle factors that we change, tissue injury from having a baby, vaginally or cesarean. So there's lots of things that can cause the prolapse, and those are pretty much the biggest signs and symptoms, the heaviness feeling. It can cause incontinence, it can cause bowel or bladder incontinence, lots of pain, pain with sex, pain with big functional activities, all that kind of stuff. I always like to encourage all of my patients to do self-checks because it's nice to just be able to kind of see what's going on. And so having a mirror and becoming familiar with like what's typical for you and what's not typical, just to have a baseline. It can definitely, that can be, that itself, doing a self-check can be very intimate and very overwhelming. And so I always just encourage yourself to give yourself that grace and know that things are different and changed on there, and just having that connection to yourself and just being aware of things that might be, in 6 months when you feel like, oh, I just started lifting weights, or I just started yoga or running or something like that. And then you look back and you're like, "Oh, well, that wasn't there before, or that wasn't like really bulging or whatever before." So that's a big factor. Pelvic floor therapy is obviously what I do. And so that's very huge, checking in with somebody. Even if you feel like everything was feeling okay, I think checking in with somebody once a year, once every other year, to have that awareness, just how you can functionally bring that awareness, that public health awareness into your functional activities. Because a lot of women that I have will be bearing down when they're lifting their kid up off the floor, or bearing down when they're picking their kid up out of the car seat, or whatever it is. And they have no awareness because they think that they're engaging. And so bearing down, that kind of pressing down, that having a bowel movement, or it can be just a very gentle kind of downward pressure. But over time, that's going to put them at risk for more of that distension of the pelvic floor, which in prolapse can be distension down typically, but it can also be just shifting things around from the scar tissue or whatever from side to side too. So yeah, that's definitely, I think that's kind of answering the prolapse question. But there's lots of things that you can do. Again, addressing the breath, addressing mobility at the ribs. There's something called hypopresses, which I don't know a ton about. There's also something called passeres, which is like the sports bra for the pelvic floor, the pelvic organs, that can kind of give you that support that you might need during those more physically demanding activities, or know what your triggers are, and know that you always feel that heaviness whenever you're on the laundry days or on the days that you have to be on your feet for work a lot. And so you wear that support then.
That was great information. Thank you so much. After I gave birth, as I mentioned before, I was using the mirrors to take a look, and I was so surprised how everything looked. I was like, whoa, that is not mine. And my vulva was so open, like a beautiful flower, but I could see right inside. And I
Yeah.
thought that it looks like I think I have a prolapse. So I went to have a check, and the doctor, he took a look, and in a minute he was like, it looks beautiful. And I was like, oh, well, I wasn't expecting that. But the gift worked. But it just gave me that peace of mind. And I think, for anyone who's concerned, go and get someone to take a look and have a check. That's totally fine to do that.
And if it's somebody that you don't feel comfortable with, or you, not that you're not happy with what they said, and they said, oh, yeah, you have, cystocele, rectocele, whatever kind of prolapse or that kind of thing, you can always see somebody else. You can always get, I think having that connection with your provider that you feel, whether it's a gynecologist, a midwife, a therapist, or anybody that specializes in it, find somebody that you feel comfortable with to be like, well, this doesn't feel right. And yeah, there are going to be things that are just going to be different. And it's just noticing what things are different and that can be okay, and what things to look for if anything changes, for sure.
Well, thank you so much for all this beautiful information. Well, I would love for you to take this space and share with everyone where they can find you and what you can have to, what we want to offer.
Yes. So, like I said, social media is probably the most popular place that I'm sure you could find me. Enlightened Pelvic Health is my Instagram page that I have. I have a Facebook page as well. And then my website, which I think you're just going to pop in this show notes. You can email me if you have any questions or anything like that. I like to be as active as I can on social media. It's definitely a love and a hate for sure. I definitely have my moments where I'm not on it at all. And sometimes I'm out. So, yeah. Can
I
finally
have the same feeling. Sometimes
Yeah.
I'm like, I'm here. I'm like, and then I'm like, okay, goodbye.
Just, it's like just like this. Like it connects you to, people all around the world. And it's just so cool to be able to have that in the learning and the educational things that are out there easily at our fingertips. But then it also can be very overwhelming and overstimulating as well. So find a balance.
First time in history that we've had this much information thrown at us from all angles through so many different perspectives. Thank you so much. Thank you so much for being here and having my daughter with me too. This is how it goes sometimes.
Yeah, I love it.
Thank you. And for all the information that you've shared and your time. And I'm sorry that we've gone over by 15 minutes, but it was so juicy and all this information was amazing. So thank you.
Love it. Yeah. Awesome. Thank you so much. You have a good rest of the day.